It's a call that no mom wants to ever get. It's like everything is in slow motion, trying to get to them.
I have a female on the line.
You're praying on the way.
What did you say? What did you do while he was lying there?
I held his hand and I told him, I said, you know, you survived this, you're strong.
For D.C. mom Asia Tamimi, the cost of gun violence in this country has been immeasurable. All three of her sons shot in separate incidents. Her youngest, Kaylin, gunned down last March in Suitland while leaving a day party with friends.
It didn't sound like an actual gunshot. It sounded more like a firecracker.
The last thing he remembered before waking up in the hospital after weeks in a coma.
I didn't even see this individual. I got shot from the back.
8 bullets pierced his body,
Can you imagine one day waking up and not being able to use your legs?
leaving him to face life paralyzed in a wheelchair at 26.
I'm thankful that my son is here and I'm thankful he's alive, but it has forever changed him. You know, not just physically, but mentally. It has forever changed our whole family dynamic.
I'm not sure if someone surviving alone is success because they will carry a psychiatric burden with them for the rest of their life.
Dr. Babak Sarani is chief of trauma surgery at George Washington University Hospital. He says most of the patients coming into his emergency department these days are like Kaylin, with multiple wounds.
We're seeing gunshots pretty much every other day. The average person will have been shot 2 to 3 times.
And most people do survive.
We very routinely discharge patients who've been shot home from the ER because we have become so comfortable managing gunshot wounds as a medical profession.
But for them and their families, managing the future is a huge challenge.
The increased healthcare spending resulting from non-fatal firearm injuries totaled, on average, $30,000 per survivor per year.
Dr. Zuri Song with Harvard Medical School followed 6,500 gunshot survivors from all around the country and found the impact is more than just financial.
Survivors of non-fatal firearm injuries experienced a 40% increase in pain syndromes, a 50% increase in mental health disorders, and an 85% increase in substance use disorders.
I want to do the exoskeleton jump, though.
How has your life changed?
My life actually has been dependent on pain pills because, if I'm going to be very frank, if I don't have anything, I can't move.
A physical and emotional toll that Kaylin has seen.
That's part of the dependency thing that has affected me as far as causing depression. I'm very independent, and now I have to depend on people for things that are even so small.
Much of that now falls on his mom, who thought at this time in her life she'd be traveling instead of being a caregiver.
There was nobody there to tell me, okay, this is what you're going to be facing. Here's what you need to know. I was on my own.
She faced her own depression after her son's shooting, and now both are in counseling.
It also shows that family members are not unscathed in the gun violence epidemic, despite not being shot themselves.
Dr. Song's study found that the family of survivors actually experienced a 12% increase themselves in mental health disorders.
It's extremely difficult, but you got to be able to make it through it.
If you could talk to the person who shot you, what would you say?
My main thing that I would say to that person is, you know, why? You know, I wasn't able, it's not like I had an argument with somebody before that.
A lot of people don't see this part of it. This is the difficult part of, you know, what the survivors have to go through in their families.
Every time Mrs. Tamimi hears about another shooting, she prays, knowing what likely lies ahead for the survivors.
It can happen to any of us. Any of us, none of us are safe. The guns, please, please, please put the guns down.
These disturbing images are now all too common around the D.C. region. The number of violent crimes with a gun is up in the district from last year.
It's heart-wrenching, and we definitely have to get these guns off the streets.
Asia Tamimi has seen the horror firsthand.
All 3 of my sons have been shot in D.C.
What has been the biggest challenge that your family has faced?
Emotional and financial.
And the financial burden of gun violence falls on all of us.
We're trying to have the everyday resident understand that they are paying for the cost of gun violence.
David Muhammad with the National Institute for Criminal Justice Reform calculates the cost of shootings for cities around the country, including D.C.
Almost always I get surprised that the cost is so high, particularly when I say this is a low-end estimate.
When someone is shot, there is a huge response from multiple government agencies.
So we looked up those salaries and proportioned their time connected to the time they spend on a scene. But we also looked at what's the average length of a shooting investigation.
In addition to the crime scene response, he looked at costs associated with hospitalization, the criminal justice process, incarceration, victim support, and lost revenue in the district.
Our analysis showed that an injury shooting costs each one $783,000 to taxpayers. So that is the everyday taxpayer paying nearly $1 million per injury shooting.
When that shooting turns into a homicide here in the district, his analysis shows the cost doubles to almost $1.5 million.
Society as a whole, taxpayers or workers through wages foregone, are footing the lion's share of the bill for the direct medical costs stemming from non-fatal firearm injuries.
Harvard Medical School doctor Zuri Song followed thousands of gunshot survivors and found their health care spending increased ×4 in the first year, and little was paid out of pocket.
96% of that increased spending was paid for by self-insured employers, our Medicare program through general revenues and taxes, or through private insurers.
Mohammed has now calculated shooting costs for 20 cities. He said D.C.'s high price tag was similar to cities in California.
We have a whole strategic plan to reduce violence in Washington, D.C.
And he presented that plan with 16 recommendations for reducing violent crime to city leaders.
We should understand why there needs to be an investment on the front end with effective violence intervention efforts, because effective violence prevention efforts cost far less than shootings themselves, but can not only save lives, but save money.
No matter where we go, odds are you've been caught on camera. At the bank, in your office, visiting the mall.
I just heard it say pow, pow, pow like that.
And sometimes those cameras catch a crime.
Made contact with our partners at Mall Security and obtained video footage.
But what if those cameras could help before the trigger is pulled?
This particular technology, I think, represents a bit of a breakthrough.
Dave Fraser is the CEO of Leesburg-based Omnalert, going high-tech to detect and respond to potential shootings.
The area is under lockdown.
It's an artificial intelligence product that monitors video cameras. It detects handguns and rifles by essentially taking the place of a human being.
An estimated 70 million security cameras are in the U.S., but according to one industry survey, less than 1% of them are monitored live by a human. Fraser said his product is always alert.
Never takes a coffee break, never gets tired or loses its attention.
Fraser says the AI technology uses security cameras that most businesses already have in place, potentially keeping costs down.
Do you have clients or businesses who are utilizing your technology here in our area?
So in this area we have schools, we have malls, and we have some banks using it.
Joe Belfiore has seen his share of gun violence. The retired D.C. police officer of 13 years now works in the security business.
Everybody has security patrols, everybody has video cameras. How well are they working together?
He's had the technology running for a few months on some cameras at apartment complexes he works with in the district.
I would describe it as like an early warning system for the potential for gun violence, like a smoke alarm for gun violence. And you have an image, of who might be carrying a gun in a location. So that's really useful.
The red box indicates that the gun has actually been detected.
Once the technology detects a gun, Fraser says within seconds it passes that information to an assigned operator who confirms the threat and activates a safety plan. That could include contacting police, sending out warnings via text, email, even locking doors in the facility.
How do you know who is, the bad guy shooter versus the police officer who walked in and has a weapon on him?
The technology is not simply just recognizing guns. It actually needs to identify that there's a threat.
In this picture, we can see a gun on it. It's holstered, so that means
Yeah, there you go. The gun actually has to be brandished for it to be determined a threat. There's many people open carry or law enforcement officers, security guards.
He says the technology is also trained to identify other common items that might look like a gun.
90% of the time, it's a phone or some other object in people's hands.
Belfiore says in his pilot program, the technology did get some false positives with cell phones, but got smarter over time. The AI did detect a weapon over the summer at one of his buildings.
So I see it as potentially being very promising.
Fraser says while the new technology hasn't stopped any active shooters yet, hundreds of weapons in businesses and even schools have already been detected.
As it is used more, we have more intelligence to be able to train it and make it better and better.
My name is Abdul. I grew up in Washington, D.C.
Abdul has seen the cycle of gun violence in his hometown. In and out of jail himself, he says he knew he was headed down the wrong path.
You know, I needed change. I was homeless. I was lost. I had nowhere to go.
But still, he was nervous when the city reached out to him about a new program offering help.
Yes, I was a little skeptical why you reaching out to me.
We're not showing his face to protect his privacy, since he's a part of People of Promise. The program, launched back in April by D.C. Mayor Muriel Bowser, identified about 240 people at high risk of gun violence.
I have assigned members of my cabinet to work directly with teams to make sure that the people we're working with are getting the services that their situations demand.
The goal, to stop the cycle of violence, poverty, and incarceration by connecting people on the list with services and resources.
When you have that level of intensive intervention, we see gun violence go down.
David Mohammed with the National Institute for Criminal Justice Reform helped create the list. He looked at several risk factors, including if a person's been involved with the justice system, affiliated with a gang, or the victim of a crime.
We hope that each of those individuals are connected with somebody who's going to work with them intensely, who's going to talk to them every single day, who's going to see them 2, 3, 4 times a week in person, develop what we call a life plan with them, get them connected to needed services.
It's been 5 months since Abdul decided to give it a try.
I talk to him myself like 3, 4 times out a week.
He says counselors, life coaches, and assistants with housing and transportation have made a difference for him.
My self-esteem went from 0 to 10.
I've been encouraged by our results thus far, and it won't be overnight.
Delano Hunter, interim director of the Office of Neighborhood Safety and Engagement, admits making that initial contact with people on the list can be a challenge.
To date, we've engaged a little over 50% of people of promise. It's a process. You know, folks have to be ready for change and want to take advantage of the opportunities that we have.
Hunter says they often use familiar contacts in communities, like a violence interrupter or a relative, to reach out first. But building that trust can take time, and time is often not on their side.
We have experienced 2 deaths, and also 8 persons of promise have been victims of gunshots. I think it underscores the sense of urgency that we have as an office and as a government to reach out to people of promise.
Some people on the list are incarcerated. The ages range from 18 to 44, but most are in their mid-20s, like Dre, who told us he's seen many friends die from gun violence.
There's more than I can count on my hands.
The father of 2 says he was also skeptical at first to be included on a list, but that the first meeting felt different to him than programs he's been involved with before.
We can get started today. I don't have to wait a week, 2. So that's what really drew me to People of Promise.
For Dre, having someone to open up to has made the biggest difference.
The therapy program, I used to think therapy, what am I taking therapy for? I don't need therapy. Like my first therapy lesson, I finally realized I needed therapy.
And he's learned some tips, self-discipline, and how to avoid those risks that got him in trouble in the past.
Oh, it's hard. It's hard every day. Still hard to this day. There's little things that can draw you back into. If you don't want it, it's not going to work.
Both Dre and Abdul, who the city provided to talk about People of Promise after a request from News 4, say they think the program saved their lives.
It gave me to believe in myself that I can do it.
And they're hopeful about following their dreams of owning a business or becoming a realtor.
They have everything for you, everything, all the resources, opportunities, everything. You gotta want it yourself.